Y estamos de vuelta. Continuamos con nuestra agenda de Interruptor 2020 y es un honor para mí presentar el conversatorio que abre la agenda del primer encuentro internacional de innovación pública Interruptor. En los primeros 30 minutos de esta charla, para que ustedes puedan conocer la dinámica, escucharemos a la doctora Esther Duflo, que en el año 2019 fue galardonada con el Premio Nobel de Economía por sus estudios experimentales para aliviar la pobreza global, junto a su esposo Abhijit Banerjee y Michael Kremer, pasando de ser la segunda mujer que recibió dicho premio y la persona más joven de la historia. En la segunda parte, en la moderación de la doctora Diana Dager, directora del Instituto de Estudios del Ministerio Público, escucharemos también a la Premio Nobel, conversando en esta oportunidad con Carlos Scartazzini, líder del Grupo de Economía del BID, y con Annie Duflo, directora ejecutiva de IPA. Este conversatorio tan importante tiene como fin recoger los aportes más significativos de la metodología que la Premio Nobel Esther Duflo y su equipo han realizado con un enfoque de innovación pública desde las experiencias que se han desarrollado para promover la innovación pública en el Banco Interamericano de Desarrollo y también en IPA. Se derivará un diálogo que busca resaltar de manera especial los aprendizajes y los retos de la implementación de metodologías derivadas de la economía y de las ciencias sociales en el marco de la gestión pública. Bienvenida a Interruptor, doctora Esther Duflo.
Buenos días. Today I'm going to present in a learning together using evidence to improve lives. So around the world, JPAL, the organization that I help create and direct, as well as IPA, IPA, work with policymakers to improve lives all over the world. And together they have the policies that JPAL and IPA researchers have found to be effective now touch hundreds of millions of people all over the world. So how does that happen? How does it work that we can go from an individual research project to something that ends up influencing the lives of many around the world? Some people, talk about what I would say a straw man. You'd run a small experiment in a few villages or in a few schools. You get some nice results. You prepare a shiny policy brief and a good PowerPoint, and you start discussing it with policymakers, and boom, they adopt it. So if this were so people start with this idea that that's the chain that where you go from experiment and method to full-scale policy adoption. And many people have criticized that model, saying, well, if the experiment is small, your gold-plated experiment gives you samples that are too small, the results are not very robust, and they might not generalize to other places as well. The results are valid in only one place, they might not replicate elsewhere. There might also be problems with experiments if not everybody takes it up, if there are spillovers on non-beneficiaries. Despite that, if you prepare your policy brief and start discussing it with policymakers, that might not fit with the policymakers' interest at the time. So, for example, if in a country, one particular government is very, very focused on dealing with education, and you just finished some project on immunization, then they might they might not have any time for you, and you might not get to have any useful role in policymaking. And if by any chance someone would anyway adopt your results, and even if these results had been valid in a small sample, they'll be quite different when they are adopted at scale. There'll be equilibrium effects because now everybody benefits from the policy. There'll be political economy effects. So the whole chain of adoption going from research to policy might not work the way you hope. So all of these criticisms are valid, but unfortunately, or fortunately, they do not at all reflect the way that the policy, the collaborative work between researchers and policymakers work. In practice, when researchers work with policymakers, or where an organization like IPA work with policymakers, it is not a short-term interaction. It is over the very long run where you don't have one result, you have a series of results replicated in many places that inform policy. And usually many of the most interesting policy experiments are conducted with the policymakers themselves. So you know that they are useful for the policymaker because they correspond to the policy demand of the policymaker. And you also know that then the work sometimes gets done on a very large scale. And so you also know that if it works, it does work at that scale. And if it doesn't work, you understand why it doesn't work in this real full-scale model and what to do to fix it. So what I'm going to do today is to give you a number of examples about how this entire chain of going from research to policy works in a couple of settings, and then that will make this much more concrete. So the first example I want to give is maybe one of my lifetime projects, which is the idea of education and how to improve the quality of education around the world, starting with India. So in India, there is a big problem with schools, and the problem with schools is not that kids are not going to schools because they're almost all in school. The problem is that many of them do not learn there. So for example, less than half of the children in class 5 can read at the class 2 level. This was true in 2011, and it's still true today, unfortunately, without much progress. So what's the problem? Well, researchers have been looking at all sorts of possible issues. So it's not that the teachers cannot teach. It's not that the children cannot learn. It's not that the salaries are too low. In fact, in a big country like India, they are quite high compared to other people in the economy. It's not sufficient to have computers or chalks or books. Computers can help, but usually not sufficient. It's been, for example, demonstrated in Latin America. It's not that parents do not care. In fact, they do care. And it's not that teachers don't want to do better. They would really like to do better. They just don't know how. So what is the problem if it's not any of that? Well, one of the problems that we finally identified is that the big issue is an issue of curriculum. In a typical classroom in India, and I am pretty sure this is similar in Colombia, there is one teacher who is teaching to a group of 30 or 40 kids, or sometimes in India more than that, and is teaching a curriculum which is extremely demanding and which leaves most of the children behind. So they have no idea what is being done after a while. So what's the solution to this problem? It's what Rukmini Banerjee and Madhav Chavan of Pratham have called teaching at the right level. So in a teaching at the right level classroom, you frequently assess and reassess children, group them according to homogeneous learning levels using this assessment, and then focus on basic skills for a period of the day or a period of the year, depending on the organization. Children keep being reassessed and move through the levels of the group as they progress, such that the teaching is always at the right level for them. And when you do that, the hope is that a learning level should improve. So this is like the end product of this model. Looks very, very simple, you know, and completely common sense, but is the end product of a long period of experimentation of research that JPAL and IPA have conducted together. JPAL and Pratham have conducted together, and IPA in some places, in fact, before JPAL and IPA even existed. So it started in 2000 with the evaluation of the ancestor of the teaching at the right level model, which is a model where a volunteer pulls out the 20 lowest performing kids in the school and provide remedial education. We evaluated that in Bombay and in Baroda in India and found pretty large effect. This was then replicated in rural India in 2005-2006, now with village volunteers who conducted community classes for rural primary school children. Again, finding a very positive effect for the kids who attend, but also finding that very few kids attend, which limits the overall effectiveness. So then there was an effort to implement this program within the school system. Because after 2006, Pratham became convinced that you cannot reach the majority of the kids if you don't work in the school with the school. So they started forming partnership with several state governments to implement teaching at the right level in government schools. And in two states, in Bihar and Uttarakhand, we got the opportunity to kind of carve out a zone where you could experiment, or even in the context of this broader generalization of the program. First, in 2008, before the school year started, we experimented with 1 month in-school government teacher-led summer camp. And this also had pretty large effect. Then from 2008 to 2010, we experimented with Pratham's new model, which was training the teachers to implement the program, and that failed. So then, in the meantime, there was a replication by IPA, in fact, led by Annie, of teacher-led versus tutor-led in-school and out-of-school teaching at the right level program, which again replicated the same result, that it works when it's led by tutor who focus on the education rather than teachers. So what is going on there? Well, one thing that what is it that we did during the evaluation of the first 2008-2010 teacher-led scale-up is that we interviewed teachers on what did they think about the program. And what we found is that most teachers really like the idea, but they told us they don't have the time to implement it because they have to complete the curriculum. So even though this was a program that was in principle organized by the government with the help of Pratham, the teachers didn't get the memo that their mission hadn't changed. They still felt that their primary mission was to complete the curriculum, and anything else was a waste of time. So therefore, we had to change the model to convince them that it was important. And for that, we did two things. One is to work with the government academic officials, the circle inspectors, who were also trained and were used to relay, these are the teachers' immediate supervisors, so they were used to relay the official message that, look, this is really going on, you have to do it. It's not something that you can do if you want. So that was an idea of changing the culture within the government, where the most important is not just to complete the curriculum, but to make sure that children are learning something. The other possibility was learning camps in government primary schools, which was replicated a little bit the idea of the original Balsaki program in Baroda, or the Ghana volunteer-led model, where basically we give up on the teachers and it's led by a village volunteer that is being trained. And both of these models, what we call the Haryana model, because it was tested in Haryana with teachers, or the UP model, which was tested in Uttar Pradesh with volunteer, both of these models worked very well. So this was encouraging, because now what this gives us is two models which have taken a long time to refine. You can see about 15 years of experimentation, but are scalable, can be easily be scaled up. These are a few of the people who were involved in the experimentation. Jim Berry, Rukmini Banerjee, Arini Cannon, and Michael Walton. So armed with this, what we could do is, number one, get a replication of the program in India. So today, Pratham is reaching something like 20 million children all over the state, the country, in various states. And secondly, is to get interest in a replication of the teaching at the right level model in several African countries. So you can see here the various places where it's being talked about or experimented. So this is really like one example of going from an NGO-led radical innovation that was born outside the system to adoption at scale within systems. And you can see that it takes a while, because with the adoption within the educational system, you require correct adaptation to the conditions. And this adaptation is done in collaboration with government officials. The second thing is, the second situation where we have a lot of collaboration with policy officials is different, where we are working with governments with programs that already are running at scale, but are not running very well, and they have issues, what I've been calling plumbing problems, which is they are not big conceptual problems, but they are logistical problems that sometimes make all the difference between a program being effective and a program being a failure. I'll give you one example, and this is the rice distribution program in Indonesia called Raskin. So Raskin is a massive program of support to the poorest household in the country that deliver rice, but the program is funded centrally and administered locally, and it has a number of issues. In particular, many people do not get what they should be getting. Either people who are eligible do not know they are eligible, or they don't know how much rice they should get, or they don't know how much they should pay. And as a result, the local officials who are implementing the program can easily siphon away a part of the rice and sell it for their own benefits. So the government contacted JPAL, in particular Ben Olken, Rima Hanna, and Abhijit Banerjee, and told them, can you help me, can you help us evaluate a small idea to try and improve this program's performance? And the small idea they had was to simply give everyone that was eligible for the program a card that has their name on it and that they are eligible for the program. And the researchers thought, well, yes, this is a great idea. Let's do this. Maybe it's going to help. So at the very beginning, the poor received only 30% of the intended subsidy they should have been getting, and they pay 25% more they should have been getting for the rice. So this is the card that the government distributed, and they also had posters saying this is your card, etc. So to make people aware that they were getting the card. And this was run in a large-scale experiment in hundreds of villages. And at the same time, the researchers that you can see here, Abhijit, Rima Hanna, Jordan Kyle, Ben Olken, and Sudarno Sumarto, decided to try various aspects of the cards to make sure, as long as they were evaluating it, to have the most effective cards. Because how would you know what works better? So one of the changes, for example, if you're looking at these two cards on the side of my slides, you can see that in one card there is a small difference. There is a 0.1 and a 0.2, and the 0.1 has the one that has the 0.1 and the 0.2 tells people how much they should pay, and the other one doesn't. They also varied who gets the card, whether it's everybody or just a fraction of the eligible people. They varied whether they created a common knowledge that the cards exist by posting posters all over the village to make it very clear, in particular to the government official, that this was going on. And finally, in some villages, they delivered much more completed cards with clip and coupons to create the impression of accountability. And the idea was not only we are going to evaluate the card, but we are going to evaluate in detail why some version works and why another doesn't work. The result was that in places who got the card, the poor families got a 26% increase in the subsidy by getting more rice and paying less for it, which was driven by a reduction in leakage to the government officials, not in leakage to people who were not barely eligible. And it was very, very, very cost effective because distributing cards is not very expensive. So it cost only $1 to increase by $8 the subsidies. And then because they had done all of these variants, they could also know which version was the most effective. And in this case, it was the version with the price indicated on it, which was distributed with the posters. So the government was, of course, had asked for this. They were very interested. So they rolled out the social protection cards in 2013 to 15.5 million poor families, reaching 66 million people. And of course, this is not an isolated program. The reason why they came to JPAL to ask them for advice in the first place is that there is a long-standing relationship between the JPAL Southeast Asia and the government, and there is a continuing partnership to improve service delivery with planned evaluation of a new reform social benefit scheme to be implemented through electronic vouchers, for example, and many other programs. So it's a real partnership where the government can get the help whenever they need it. The last example I want to give you, which is, particularly timely, and will give you another idea of the time, because you're thinking, well, it's very nice to do evaluation for 15 years, but we don't really have the time. And of course, in the COVID case, we don't have the time. So I wanted to give you some example of other policy collaboration that has happened in the COVID response time. So when the COVID crisis started, JPAL and IPA immediately shifted gears in terms, of course, of their own research, but also to use the existing infrastructure to try to run research projects that could give actionable research results immediately. So there is a project going on in Colombia. You're probably aware of it more than I am, so I'm not going to spend time on it, but I'm going to give you two examples from the broader framework of my own work. The first one is the COVID-19 prevention messages in India. So Indians, probably like everyone, the world has been bombarded with COVID-19 prevention message with a lot of information and disinformation. And so the question is, can they pay attention to one more? And would that lead them to change their behavior? So what we wanted to do very early on with a group of people who have been involved before in demand for preventive health services, in particular immunization, is can we do something? And Ben Olken had done some project in Indonesia using stars to promote immunization on Twitter. So we thought, well, it would be nice to have a star, and we tried to look some movie stars. We couldn't find them. Finally, we realized we had a star in our own team, who is Abhijit Banerjee, who, since he won a Nobel Prize, is really like a household name in West Bengal, where he is a native of, and also happens to be the chair of the COVID-19 response team. So what he did is he sent video messages to 25 million subscribers of Geo, one of the network, in randomly selected PIN code throughout the states. And when we compare adherence to social distancing as well as symptom reporting in those PIN codes compared to the control PIN codes, we find very, very large difference. So this was very encouraging. And subsequently, already since that happened, so this happened in April, May, subsequently, there was two scale-ups, one in June and one in September, to about 80 million subscriber of Airtel, the other big network. The last one being very recently, a few weeks ago, to encourage diminished travels during the holidays. There was a big set of holidays in India. In fact, there is one coming up also right now, which is Diwali. But in India, it's Durga Puja, which is at the end of October. And traditionally, many people travel and attend public ceremonies outside where it's extremely crowded. And there was a huge worry that it would lead to a flare-up of the infections. So Abhijit sent some email some video messages to the Airtel subscriber, asking them to not travel for Durga Puja, and if they did, to limit their attendance to just one, and to stay home if they were fragile and otherwise wear a mask. This was not an experiment because this was already a scale up to everyone we could reach in West Bengal. So we do not know the effect. What we do know is that there was no uptick in COVID-19 infection in West Bengal after the holidays. So whether that played a role or not, we can't ascertain, but we do know that this was based on evidence that suggested adoption and that it was effective. We are currently in the middle of running the same type of campaign with Facebook in the US in advance of Thanksgiving. So we got doctors to record messages, short messages encouraging people to show their love by stay home for Thanksgiving, and it's already been sent to about 10 million people in the country. So I don't know the effect of that yet, but we'll find out. I gave you with the example of Indonesia the importance of a very long-term established partnership. So this is something that we have in several countries. One of the example is Tamil Nadu, where there is a combination, there is a partnership. You can see us, Shobini here, the head of JPAL South Asia, with the Chief Minister of Tamil Nadu and a very high up secretary who is the chief of the steering committee when we signed the MOU. And the MOU is for research, which is financed by the government, policy dialogue, scale up, and capacity building. Here are a few of the activities that we completed in the course of this MOU. So several studies for 3 are large scale and completed, 9 were smaller scoping studies, and 3 are ongoing. Again, in COVID-19, there was a huge shift to COVID-19 work. I'll give you an example in a minute. And we also have COVID-19 response advising. We've been talking to the government, capacity building by various departments on methods, statistics department, panel survey, digitization, quality work, etc., and 1 scale up of a mass game project. One example again of the importance of having this collaboration. We have an ongoing long-term panel of older people going on in the States. So what is interesting is that India is actually an aging population, but until now we didn't fully realize it. In Tamil Nadu, there are many people who are elderly people who are living completely alone because their children are gone to the city. And there are very many poor people who do not avail to the social pension that they would be eligible for. So we had concluded, we have already completed 1 wave of a panel of older people. Out of this, the government, we gave the government a sample of people who were eligible for old age pension but were not currently receiving it. And the government reassessed a few of their cases and gave them pension. So this gives us a unique opportunity to look at the impact of old age pension on COVID-19 resilience. So in April 2020, a month into the lockdown, we ran a first survey in control and treatment household, people receiving the pension and people who were not receiving it. And we found large effect of pensions on food security and other support from family. One of our co-authors is a high-level bureaucrat. She used to be the chief secretary of Tamil Nadu. We've already shared it with the government in the steering committee, and now they are interested in creating a committee that will reevaluate eligibility to pension, because they realize, thanks to this research, that the pension is actually a very effective method to protect the poor in the context of COVID-19. The most important thing is that through this work, in the lab in Peru, for example, where IPA played a key role, our various government research partnership in India and Indonesia, etc. We are kind of fostering, we are helping to foster a culture of learning and a culture of learning together. Getting questions from government officials, working with them through the answer and through the next set of questions. Many of the governments we meet want to run their own RCTs. That they are not so interested in just getting our shiny policy briefs. They want to learn together. And the hope is that one day we can make ourselves irrelevant, because everyone will be able to do that themselves and to incorporate this into their own day-to-day work. And in a sense, this is the most policy influence that we can have. So I will thank you very much and for your attention, and I look forward to the discussion. I'm going to unshare.